A cause for huge concern. Statistics show that the country is dealing with 150 new infections per 100,000 of the population.
There's no area now called the what do you call it, hotspot. It's now the whole country. That's why we are at level 4 of transmission. Okay, if it's a cluster where there are just 20 people per 100,000, it will be level 1.
Government says they've amplified their response by increasing testing. There's a proposal before Cabinet to avail funds in order to employ more healthcare workers as well as procure tests, PPE and medication. Deputy Health Minister says they've even increased the number of beds.
Most of our COVID centers, for instance, Parenyato has got 425 beds. And I'm sure as of yesterday, they were about 68? 68. Yes, they were about 68. So at Par we still have that gap. Wilkins is not full. UBH in Blawa is not full. Victoria Stepo in Utari, literally I think there was one patient. So the beds are there. It's important for people to really check for themselves than to rely on social media hearsay.
The second wave brings with it intense pressure on a crippled health system, and medical practitioners dispute government claims.
In Parenyato, it actually have only 2 wards functioning at the moment as COVID wards. And if you compare for a city with Harare and the population of Harare, those 2 wards are nowhere near enough. If you go to Bulawayo as well, you see that we have UBH at the moment. That is the only functional hospital that is there in terms of offering COVID-19 services. Also, it's not adequate for such a big city. And if you go to other provinces, like I mentioned before, of course you would have isolation wards. These are just wards where people with mild symptoms can be admitted. Those, they are there throughout the country. But when it comes now to intensive care facilities, when you have a patient with severe COVID, that's where we have a problem. Out there in other provinces, we do not have those facilities. And those are the facilities that we are saying they need to be increased.
In this last week, social media has been abuzz as prominent Zimbabweans took to Twitter inquiring about the availability of beds and oxygen for infected relatives. Matara says the picture is as dire as social media users have painted.
Even us as healthcare practitioners and medical doctors, we are actually having a situation where you want to refer a patient to a COVID-19 treating facility and you are told that we do not have a bed to admit that patient. So it's not a grapevine, it's something that is happening. People are being turned away mainly because in public hospitals they might be full and there is no bed capacity, and in private where the bed might be available, they would not have the resources that are needed, the financial resources to pay for that bed.
Meanwhile, midwives in the Sally Mugabe Hospital in Harare downed tools refusing to work. A matron who tested positive on Sunday died on Thursday morning. Nurses claim they're not being issued with PPE and feel their lives are placed at increased risks. They say they'll return to work once they receive sufficient personal protective equipment. Nomapolani, SABC News.